for cleanings or exams, they usually cover that at 100%. For basic procedures, they cover that at 80%. And for major services like crown, bridges, and dentures, they cover it at 50%.
So now what you're getting there is certain levels of coverage depending upon the type of procedure that you're going to be doing. Most of the patient that comes in, they're coming in diagnostic, which is covered at preventative level. So they've got what they call preventative. The next one would be basic. And then after basic, they've got major. So when the insurance company goes ahead and give you benefits, they're going to go ahead and say, this is a preventative, basic, or major. And so from there are percentages that the insurance company will cover. They'll cover it at 100% on preventative.
That includes cleanings, exam, and x-rays.
Yeah, so when they talk about preventative, they are talking about diagnostic, which is x-rays and exams. When they talk about preventative, they talk diagnostic. They also talk about prevention type procedures like teeth cleaning. That would be considered preventative. And most insurance company will cover that at 100%. So that means that if you go to the dental office, you could expect that the insurance company will go ahead and cover most of that in the fees, especially if you're a provider that will accept assignments from the insurance company. So if you've got a first appointment in a dental office, you could expect, if they are working with that company, if your dental office is in network, if your dental office is able to process that claim, if your dental office could work with that insurance company and accept assignment, your preventative coverage will cover your first appointment. And you want to know that because you don't want to have any surprises when you go to a dental office. So cleaning, exam, x-rays would be considered under preventative. Yes. So preventative will include cleaning, exam, and x-rays. And that would be covered in most cases when you make a dental appointment at a dental office. They will cover that at 100%. The insurance company would. So now once you get into the basic portion of your coverage, they cover the basic at
usually 80% from what I see with our patients.
Yes. So when we say the majority of the patients that you'll see, usually they will cover 80%. The standard of dental insurances are 100% for preventative, 80% for basic, 50% for major. So we're covering now what is basic. Basic would be considered like what type of procedures would be basic?
So we do restorative fillings, that means amalgam or composites, and then we do perio treatment, that's considered basic, endo root canals, that's considered basic, and sometimes oral surgery, depending on your insurance.
Yeah, so who's going to determine what's basic, what's major? It's the way that your company, the way that who's purchasing the insurance that you've got will clarify what is covered under basic. Sometimes oral surgery would be under basic. You have to know from your group number that you've gotten, the insurance company that you're working with, what is covered under basic. So when they say basic, that could mean a lot of things on different plans. So you could have a company and they have certain criteria to be either basic or major, and then your dental office will have to do the research for you, or you have to do the research for yourself to figure out what is this procedure covered under. Is it going to be covered under basic, or is it going to be covered under major? So you've got preventative 100%, basic 80%, major 50%. So 50% of the fee. When we're talking about percentages, it's 50% of whatever that fee would be. So if there's a procedure that was $1,000, if there was a procedure that was $100, it would be 50% of $100 would be the coverage for the major. So if the procedure cost $100, the insurance will cover $50, and then the portion that you will be responsible for would be the other 50%.